Good evening to all of you, and uh, thank you, thank you, Abhishek, for inviting me here. And I thank ICT Forum for giving us opportunity where we will talk about it. Before I start, I just want to narrate a small story what I wanted to talk. So prior to this, I was associated. I was associated with one of the leading hospital chain. And when Fujifilm called me, Abhay, why don't you lead us in India? I was very surprised. Why me? I am part of business which is core of healthcare, which is hospital where doctors are involved into it. Why they are looking for me for this space? So they just invited, and I visited their center in Indranagar. I was just blew out by their look, by the process, whatever they have implemented over here. And at that moment, I thought this is the preventive screening which India needs it. We all know that our India disease ecosystem, we have moved from communicable disease to non-communicable disease. So problem with a non-communicable disease is that it hits slowly, and one fine morning, bang, okay, we know that we all have a disease, now we have to deal with that. That's a challenge with the non-communicable disease. So it is important if we identify at a stage where it can be reversed or it can be changed. So where the NURA started with, and my journey with NURA started with that. So on that note, I will just try to take you through. I'll give you just a glimpse of it, that what we do, how we do, what is our objective of this one. So when we look at this image, you know, what thoughts comes in our mind? The first thought comes in our mind that he is very healthy, he is surfing and he's enjoying his time. Same time he's mitigating through the risk which is beneath the water or above the water, is trying to surf. So to do this, he has to be in a good health, and to do this, he should be aware about the risk associated with this sports. So that's what we say, that, you know, health screening lets you keep doing what you love. That's the whole idea which we do that. So, you know, what is this screening, health screening all about? We all know that, you know, what is the routine part of it. Routine part of it, that we get the symptoms, we go to the doctor, based on our symptoms, doctor prescribe it. So again, Abhishek was talking about the data. So based on the data which we give it to the doctor prescribe the diagnosis, treatment, lab test. Based on that, treatment happens. Or sometimes we pop up we do self-medication as well. But screening is the very, very proactive approach towards it. It is for the people who are healthy, who have preventive orientation towards their health. So it is for them. So that's the idea which we have started with. Now, if I say this, now next is that what is the factor which is impacting India most? So if you look at the data, which data I have pulled it out from one of the research paper, heart attack is one of the biggest factor in India which is killing after the accidents. When it comes to disease, then next is the lung. TB is also very, very close to it. So if you look at it, that how we can prevent it, these all are non-communicable disease. So how we can address it? And cancer is also not very far. So I was just quoting few data over here. So if you see, every year 20 lakhs of new cases of heart disease is getting registered and identified by the government. And mostly they are urban population. 70% of them are urban population. And then you have lung diseases. This is happening due to the pollution, smoke, lot many unhealthy habits as well. So India is capital of lung diseases, oral cancer, diabetes, and all those things. So, you know, when we were sitting at NURA, when I was trying to work around this whole thing, I was just thinking that what all things can we do so that we can help people to improve their health. Cancer is not very far. Almost 11 lakhs people are getting impacted by the cancer every year. And approximately 7.5 lakhs are failing to that after identifying the disease. So that's a big challenge for the India. And we all know that 80% of the cases which we identify in India, identified in third or fourth stage of the cancer, we do not manage to identify in the first stage itself. So that's the main reason for that. So if you look at whether it is male or female, even female has the higher incidence rate of the cancer. So I will just, why this is happening? The reason why this is happening, because India lacks the systematic screening program. And if we have systematic screening program like other countries, we will be able to save much more life. So that's the challenge. Here, screening is more of a feeder for a hospital, but other part of the world, it is a process where they can save life. So I've just tried to compare the life expectancy and the disease for the two different countries. Japan happened to be has the highest life expectancy, which is approximately 85 years compared to India, which is just 70 years old. So if you look at the survival rate post contracting the disease, Japan is much ahead of it. More you move toward the right side of the graph, if you'll see that the gap is keep on widening. So that's the challenge. It is just happening due to the non-availability of the systematic screening program in India. That's the main reason. So at NURA, when we started this, which is one of the premium AI health screening center in India, it started by Fujifilm and DKH Group. We try to pull out all the pain point from the screening which any one individual go. So try to break all the inertia which is there to restrict people coming to the health screening. So I will just try to emphasize on what AI technology is using. So Fujifilm has worked for more than 17 years to collate or develop this AI. They have collated 500 million images of the different organ, positive, negative, false positive, false negative cases, and they have created the AI tool which is helping the individual to that. So when I say this image, we are trying to also use the ultra low dose radiation, which is very helpful because we all know the radiation causes cancer. So when we started using ultra low dose radiation, the problem is that image will not be very clear, very crisp. So AI is helping us to create that images, and second layer of AI help us to do the interpretation. So AI become a tool for a doctor to do the interpretation and provide accurate and correct information to the guest to solve the problem. This is one of the case study done by Fujifilm while developing the AI. This is the image of the breast of the women. She has done a screening in 2011, 12, 13. In 13, with the help of biopsy, they identified that there was a cancer. But when they run this screening through the AI tool, they have identified there was a lesion which formed in 2011 itself and which become cancerous in 2012. So idea is that to identify any kind of risk at early stage so the guest or individual can try to reverse it, get it cured in time. So I invite all of you to be part of the good health. I know many of you must have visited the NURA, but I also request if we have the corporate program, which if we can do it, that will be great for us. Thank you on that note. Thanks a lot.